Warning: watch this video or you will regret it. 70 years old, the age that everyone thinks is rest, leisure, enjoying old age. But the truth is different. Behind the gentle smile, behind the seemingly healthy appearance, are a series of silent diseases that even the people involved do not know. Many old people can still walk, still chat happily, still eat well, but then one day they collapse from a stroke, are hospitalized for heart failure, are diagnosed with late-stage cancer, or live tiredly because of diabetes, bones, joints, liver, kidney, without knowing that the disease has been rooted for a long time. Medical research shows that people over 70 years old on average have at least 2 chronic diseases, sometimes 3 to 4 diseases at the same time. And sadly, most only discover when the disease is severe. So why do old people easily have many diseases without knowing? Which diseases are the most common hidden enemies after the age of 70? And how to prevent this silence? Why do the elderly easily get sick without knowing it? Old age is the period when the body begins to degrade comprehensively, from the immune system, cardiovascular system, respiratory system, to digestive system, nervous system. This makes it easier for diseases to attack, and when diseases appear, the symptoms are often very faint. There are 3 main reasons why the elderly get sick without knowing it. 1. Unclear symptoms. Many chronic diseases, such as high blood pressure, diabetes, hypothyroidism, osteoporosis, do not cause obvious pain. Patients still live normally without seeing anything wrong. 2. Confusion with aging. The elderly often think that pain, fatigue, dizziness, insomnia, loss of appetite are normal in old age, so they ignore or do not go to the doctor. 3. Not going for regular checkups. Due to economic conditions, subjective psychology, or fear of disease, many elderly people do not have regular health checkups, leading to the discovery of diseases when they have complications. As a result, a 70-year-old person may have 2 to 4 chronic diseases, but still think they are healthy until an incident occurs. As a result, the elderly often die not from a specific disease, but from a combination of many diseases at the same time, causing the body to rapidly collapse. Five most silent diseases that the elderly often suffer from. Here are 5 silent diseases that people over 70 years old are very susceptible to, but often not detected early. 1. High blood pressure is a silent killer. More than 60% of people over 70 years old have high blood pressure, but have no obvious symptoms. Without timely treatment, the disease can easily cause stroke, heart failure, kidney failure. 2. Type 2 diabetes. Older people often do not feel thirsty or urinate as much as young people. The disease progresses silently, causing complications in the eyes, heart, and kidneys without being noticed. 3. Osteoporosis. No pain, no swelling, but bones become weaker and weaker. Only when the femur is broken or the back is hunched do we know. Postmenopausal women are especially susceptible. 4. Decreased liver and kidney function. The body still functions normally until the liver and kidney function is severely impaired. Signs of fatigue, drowsiness, and loss of appetite are easily mistaken for age. 5. Hypothyroidism, underactive thyroid, causes fatigue, weight gain, cold hands and feet, lethargy, but these are all very vague symptoms that are easily overlooked. In addition, diseases such as dyslipidemia, anemia, osteoarthritis, depression, dementia are also very common after the age of 70. No one thinks they are sick until their body's exhausted. Consequences of late detection. Late detection of the disease not only makes treatment difficult, but also significantly reduces the quality of life of the elderly. Here are some typical consequences. 1. Severe complications that are difficult to recover from. Uncontrolled high blood pressure can cause stroke. Undetected diabetes can lead to blindness and limb necrosis. If the disease is detected early, all of these complications can be prevented. 2. Costly. When the disease is severe, hospitalization, multiple medications, and prolonged treatment are required. The cost is many times higher than regular checkups and early detection. 3. Mental breakdown. Many elderly people fall into depression and despair when they suddenly learn that they have multiple diseases at the same time, especially when they have to depend on their children and grandchildren. 4. Reduced life expectancy. Research shows that elderly people with 2 or more chronic diseases are 3 times more likely to die early than healthy people. 5. Burden on the family. When the disease becomes severe, the patient is bedridden, loses the ability to care for himself, causing great pressure on time, money, and psychology for relatives. Late detection of the disease, not because there are no signs, but because we do not care enough. By the time we know, it is too late, and by then, the price to pay is very high. How to know if you are sick. The good news is, it is not difficult to know if you are sick. The question is, do you want to know or not? Here are 4 things people over 70 should do to control their illness. 1. Regular health checkups every 6 months, including measuring blood pressure, blood and urine tests, checking liver and kidney function, screening for diabetes and blood lipids. This is the fastest and most accurate way to detect diseases early. 2. Listen to your body. Don't think of fatigue, insomnia, dull pain, or weight loss as everyone gets older. Any change can be a warning sign of illness. 3. Take note of unusual symptoms. Write down any prolonged abnormalities: forgetfulness, loss of appetite, headache, chest pain, persistent cough, constipation, and discuss with your doctor. 4. Change your lifestyle even if you haven't gotten sick yet. Eat healthy, exercise lightly every day, quit drinking and smoking, get enough sleep, and stay optimistic. These seemingly small things are the most effective preventive medicine. Most importantly, don't wait until your body gets sick before you care. Consider health as capital. The sooner you take care of it, the easier old age will be. Old age is not scary. What is scary is living in the illusion that you are still healthy, only to collapse one day without understanding why. After the age of 70, having 2 chronic diseases is too normal. But that does not mean you have to live in pain. If detected early and cared for properly, you can still live happily and healthily until the end of your life. Don't wait until you have symptoms to go to the doctor. Don't be afraid to learn about your health. And most importantly, don't see illness as something shameful. Knowing you have an illness is the first step to living more wisely. Thank you for watching until the end of the video. If you find the content useful, please like the video, share it with your loved ones, and subscribe to the channel to receive more useful information about the health of the elderly. Wishing you and your family a happy, healthy life, regardless of age.